Hello, welcome to Dental Practice Risk Management through Regulatory Compliance, Part 11, Texas State Board of Dental Examiner Rules 108.13 and 108.14, Practice of Dentistry on Certain Children, and Pediatric and Special Needs Case Management, Protective Stabilization. My name is Boyd Shepard, and I am a clinical associate professor in the Department of General Practice and Dental Public Health at the UT Health, University of Texas Health Science Center at Houston School of Dentistry. Please know, I receive no financial benefits that would create a conflict of interest or restrict my independent judgment with regard to the content of this presentation. At any time while viewing the video streaming course, you can take a break by simply pausing your computer. At the completion of this section, you will be asked to take a short exam in order to complete the requirements for streaming video courses. At the time, you will receive instructions regarding taking your exam. Dental Practice Risk Management through Regulatory Compliance, Part 11, Texas State Board of Dental Examiner Rules 108.13, Practice of Dentistry on Certain Children, and 108.14, Pediatric and Special Needs Case Management, Protective Stabilization. Overview. This online course is designed for dental practitioners to gain a greater understanding of the Texas Dental Practice Act and the rules and regulations of the Texas State Board of Dental Examiners, specifically TSBDE Rules 108.13, Practice of Dentistry on Certain Children, and 108.14, Pediatric and Special Needs Case Management, Protective Stabilization, so that they may implement the appropriate changes and systems in their day-to-day practice that ensures regulatory compliance with these rules and laws. Through understanding and implementation, the participant will also be managing the risks inherent in the modern dental practice. Course objectives. Upon completion of this course, the participant will review, understand, and be able to apply the relevant provisions of the Texas Dental Practice Act and the Texas State Board of Dental Examiners Rules and Regulations. The participant will be able to apply Texas State Board of Dental Examiner Rules 108.13, Practice of Dentistry on Certain Children, and 108.14, Pediatric and Special Needs Case Management, Protective Stabilization, the focus of this presentation. The participant will value ethical and legal approaches to clinical dentistry in your own practice, and the participant will review and implement the risk management procedures and protocols that will prevent patient complaints to the Texas State Board of Dental Examiners. Okay, let's get started. Dental Practice Risk Management through Regulatory Compliance, Part 11, Texas State Board, Dental Examiners, Rules 108.13 and 108.14, Practice of Dentistry on Certain Children, and Pediatric and Special Needs Case Management, Protective Stabilization. Before we dive into these rules, it is important for the participant in this presentation to understand that the Texas State Board of Dental Examiners performs 3 different primary functions. 1. The licensing of dentists and dental hygienists. 2. The annual registration of all dentists, hygienists, and labs. And 3. Enforcement of Texas laws regulating the practice of dentistry. It is also important for the participant to know where in the world do you obtain or find the rules that regulate your license and practice. Where do you find the Dental Practice Act and the rules and regulations of the Texas State Board of Dental Examiners? Simply, you can go to your favorite search engine in your web browser, in this example, Google, and search for Texas Board Dental or Texas Dental Board. And the first link that the search engine should show is the URL and link to the Texas State Board of Dental Examiners. That is where you will find the laws and rules that regulate your license. On this website, you'll have full access to the Dental Practice Act, the Texas Administrative Code, otherwise known as the board rules. You'll also have access to dental board policy statements, the best example of which is their policy statement with respect to the use of Botox in the dental practice. The board has also put together an amazing and very helpful web page as part of their site where they respond to and answer frequently asked questions that they receive often in their office. Also, the board provides links to and documents in the way of forms that can be used in the dental office that allow the dental practitioner in the state of Texas to be in compliance with state board rules. All of this information is essential to the risk management in the Texas dental office. One thing to note, the difference between the Dental Practice Act and the Texas Administrative Code or board rules is that the Texas Dental Practice Act is the law that is enacted by the legislature, whereas the rules are voted on and enacted by the state board. The Dental Practice Act, via the legislature, creates the state board and gives them the authority to pass and implement and enforce board rules. And that is the difference between the two bodies of law. Please be aware, new rules are always being proposed without notice to you. Later in this presentation, I will show you how to check the State Board website for finding new rule proposals as well as amended rules. Another way to keep track of this information is to subscribe to the Texas State Board of Dental Examiners newsletter at this email address. When you go to the Texas State Board of Dental Examiners website, you can click the link on the top menu bar for current issues, and you'll see the link for recent rule proposals. This is where you can read about proposed rules and proposed amendments to existing rules. Under the link on the top menu bar for laws and rules, you can find the sublink for recent rule adoptions. These are rules that were once proposed or amendments that were once proposed but are now have gone through the entire review and voting process and have now been adopted by the state board to be enforceable rules. These are under this sublink under laws and rules. Again, Simply Google or use your search engine to find the Texas Dental Board. You'll have the link immediately, which will take you to the home page where you can find the top menu bar, click Laws and Rules, and then you can also find the sublink for the Texas State Board of Dental Examiner rules, as well as the Dental Practice Act. Today, we will be clicking on and going to the pages for the Texas State Board of Dental Examiner rules. On this page, you will see two links. Both will take you to the State Board of Dental Examiner rules and regulations. The top link takes you to a web-based HTML format version of the rules, which is much easier to navigate than the second version, which is the bottom link, which is in PDF format. I do recommend that you download the PDF format to your computer, but otherwise you can access the full account of the rules in the top link, again, which is much more easy to navigate. Once you click the top link for the State Board of Dental Examiners rules and regulations, you'll be taken to this page, which is a menu or table of contents for the chapters that are included in the board rules. These are the several chapters that make up the State Board of Dental Examiner rules. We'll be spending our time in Chapter 108, Professional Conduct. However, do look at and make note of the additional chapters, including the Chapter 104 with respect to continuing education, the Chapter 110, Sedation and Anesthesia, Chapter 103, Dental Hygiene Licensure, Chapter 114 and 115, Extension of Duties to Auxiliary Personnel, Dental Assistants, and Dental Hygienists, and so on. All of these would be important areas for you to take a look at and review to give you an idea of what is required under the law that regulates your license in these different areas. Again, for today, we'll be clicking and looking at Chapter 108, Professional Conduct. Specifically, Subchapter A of that chapter, Professional Responsibility. Momentarily, please take a moment to review Sanitation and Infection Control, Subchapter on Mobile Dental Facilities, the subchapter on Business Promotion, and the subchapter on Contractual Agreements. Every dental practice will be subject to Subchapter B, Sanitation and Infection Control, as well as Subchapter E, Business Promotion. Not every practice will be subject to Mobile Dental Facilities or the Contractual Agreements subchapters. However, it's important for you to review these to assess and to understand what the rules require in these areas. Looking at Chapter 108, Professional Conduct, Subchapter A, Professional Responsibility, you see an additional menu or table of contents for Chapter 108, Subchapter A. These are the rules and regulations that most complaints, allegations, and violations arise from, because it's in these areas that your day-to-day practice of dentistry participates or lives in. These are a broad overview of issues you will encounter on a daily basis by default by being in the business of dentistry. Today we'll be looking at the last two, 108.13 and 108.14, do make note of the additional rules that are listed in this subchapter. In this risk management video series, we have covered all of the foregoing rules in this subchapter in separate videos, this being the final video to cover 108.13 and 108.4. So a discussion on all of the prior or rules listed above are available as well. This is how this rule appears online on the Texas State Board of Dental Examiners website. We will be reviewing the rule in detail on the following slides. Rule 108.13, Practice of Dentistry on Certain Children. Rule 108.13, Practice of Dentistry on Certain Children. Subpart A, the parent or guardian of a child younger than 18 years of age may be present in the treatment room during the child's dental treatment or procedure, unless the dentist determines in the dentist's professional judgment that the presence of the parent or guardian in the treatment room is likely to have an adverse effect on the treatment of the child. The decision to exclude the parent or guardian must be documented in the patient's record. Subpart B. In this section, parent or guardian includes a person authorized by law to consent for the medical or dental treatment of a child younger than 18 years of age. Going back to review the rule. The parent or guardian of a child younger than 18 years of age may be present in the treatment room during the child's dental treatment or procedure. In other words, if a parent or guardian requests to be present, there is no mandatory obligation of the dentist to allow the patient's parent or guardian to be present, and gives the exception that if the dentist determines in the dentist's professional judgment that the presence of the parent or guardian in the treatment room is likely to have an adverse effect on the treatment of the child, then there's no obligation to allow the parent or guardian. My recommendation is that if you are going to determine that, or if you do determine in your professional judgment that the presence of a parent or guardian in the treatment room does and is likely to have an adverse effect on the treatment of the child, that you have a very specific reason, because the rule also requires you to document that decision in the record. Documenting the decision may not be enough, and the rule doesn't specifically state that you have to put the reason, but the interpretation of the rule is you are documenting the decision which needs to be supported by the reason that you made that decision. Because the main body of this subpart says that you're determining this based on your professional judgment that there would be an adverse effect by the presence of the parent or a guardian. Now, you could state that as a reason that the presence would have an adverse effect. However, more detail is typically better in this situation. In other words, what was occurring, what were the circumstances, what specific conduct, commission or omission of the parent made it such that you arrived at that professional judgment. I would highly recommend that you have a basis for your decision that you can give detail on when you document this in the patient record. Obviously, the subsection defines parent or guardian to include a person authorized by law to consent for the medical or dental treatment of a child younger than 18. My recommendation here is if someone states they are a guardian, more than likely they are being truthful about that. However, you would be well within your rights if you have some suspicion that they are not the legal guardian to ask them to provide documentation, a court order that authorizes them to, or some sort of power of attorney that authorizes them to make these medical or dental decisions. Moving on to Rule 108.14, Pediatric and Special Needs Case Management, Protective Stabilization. The Texas State Board of Dental Examiners utilizes the guideline on protective stabilization for pediatric dental patients published in the American Academy of Pediatric Dentistry in determining the standard of care for protective stabilization used in dentistry. So, Subpart A of Rule 108.14 advises the licensed practitioner of the guidelines that the dental board refers to for determining the standard of care for protective stabilization used in dentistry. That being the guideline on protective stabilization for pediatric dental patients published in the American Academy of Pediatric Dentistry. Subpart B. Pediatric and special needs patients may require specialized case management to prevent injury and protect the health and safety of the patient, practitioner, and staff. The goals of patient management are to establish communication throughout dental care, alleviate fear and anxiety, deliver quality dental care, build a trusting relationship between the patient, parent, or guardian and the dental professionals, and promote the patient's positive attitude towards dental care. In addition to patient management, it may be necessary to use protective stabilization for treatment involving pediatric and special needs patients. This part of Rule 108.14, Subpart B, is essentially a statement of the necessity of this rule, a basis for the rule, the reasoning behind the rule. Acknowledging that pediatric and special needs patients may require specialized care management, and that the goals of that patient management are listed extensively, and also acknowledging finally that it may be necessary to use protective stabilization for the treatment involving pediatric and special needs patients. With respect to protective stabilization, the rule states that protective stabilization is considered an advanced behavior guidance technique in dentistry. That protective stabilization is any manual method, physical or mechanical device, material or equipment that immobilizes or reduces the ability of a patient to move his or her arms, legs, body, or head freely. Two types of protective stabilization are active stabilization, which involves restraint by another person, such as the parent, dentist, or dental auxiliary, and passive immobilization, which utilizes a restraining device. Protective stabilization shall cause no serious consequences, such as physical or psychological harm, loss of dignity, or violation of the patient's rights. Training requirements. A dentist utilizing protective stabilization shall have completed advanced training either through an accredited postdoctoral program or pediatric dentistry residency program that provides clinical and didactic education in advanced behavior management techniques, or advanced behavior management that includes both didactic and clinical education pertaining to protective stabilization. Practitioner supervision. The dentist shall not delegate the use of protective stabilization to the dental staff, but they may assist the dentist as necessary. Obviously, being they, the dental staff, may assist the dentist as necessary, but the dentist shall not delegate the use of protective stabilization. The dentist must be the one who performs or uses or utilizes protective stabilization. Consent. Protective stabilization requires written informed consent from the parent or guardian, which should be obtained separately from consent for other procedures to ensure parent awareness of the procedure. Informed consent shall include an explanation of the benefits and risks of protective stabilization, alternative behavior guidance techniques, and a clear explanation of the anticipated restraining devices. As you recall, Rule 108.7 is the law that deals with the standard of care and has the sub-rules with respect to informed consent. And so any informed consent form utilizes for this consent of protective stabilization should follow the guidelines detailed in Rule 108.7 and then kept as a part of the patient record in compliance with Rule 108.8, records of the dentist. Parental or guardian presence. Practitioners should consider allowing parental or guardian presence in the operatory or direct visual observation of the patient during the use of protective stabilization, unless the health and safety of the patient, parent, guardian, or dental staff would be at risk. If the parents or guardians are denied access, they must be informed of the reason with documentation of the explanation in the patient's chart. So again, this is more support for the advice of detailing any reasons that parents or guardians are going to be denied access with a complete explanation, not just a statement that they're being denied, but the basis for that denial. Pre-stabilization considerations. Prior to utilizing protective stabilization, the dentist shall consider the following. A, alternative behavior management methods. B, the dental needs of the patient and the urgency of the treatment. C, the effect on the quality of dental care during stabilization. D, the patient's comprehensive, up-to-date medical history. E, the patient's physical condition, such as neuromuscular or skeletal disorders. And F, the patient's emotional development. Obviously, there may be considerations involving each of these items or some combination of these items or every one of these items. These are considerations that should be identified and evaluated prior to using protective stabilization. And it uses the language shall. In other words, the dentist shall consider the following and shall do it before utilizing protective utilization. Again, it is advised strongly that these considerations and what was considered important, whether all, a few, or a combination, be detailed in the progress notes in the explanation of the decision to use protective stabilization. All of this detail, including what was considered according to this list, should be included in those progress notes. Equipment. The restraining devices used for dental procedures should include the following characteristics. These are restraining devices used for protective stabilization. They should include the following characteristics. A, ease of use. B, appropriately sized for the patient. C, soft and contoured to minimize potential injury to the patient. D, specifically designed for protective stabilization. And E, ability to be disinfected. As you can see by reading each of these items, you can understand why each of these components would be important both to you, the practitioner, as well as to the patient. Indications. Protective stabilization is indicated when A, a patient requires immediate diagnosis and/or urgent limited treatment and cannot cooperate due to emotional and cognitive development levels, lack of maturity, or medical and physical conditions. B, emergent care is needed and uncontrolled movements endanger the patient, staff, or dentist. C, indicated when treatment is initiated without protective stabilization and the patient becomes uncooperative, causing uncontrolled movements that endanger the patient, staff, or dentist, and protective stabilization will enable the dentist to reach a safe stopping point. D, indicated when a sedated patient becomes uncooperative during treatment. Or E, indicated when a patient with special health care needs for whom uncontrolled movements would be harmful or significantly interfere with the quality of care. Again, all of these indications are a list of additional considerations very, very specific to the patient's condition, and specific to the reason that the doctor made the decision to utilize protective stabilization. This is the level of detail that should be included in the explanation for that decision to use protective stabilization. Contraindications. Protective stabilization is contraindicated for patients who are cooperative or non-sedated, patients who cannot be immobilized safely due to associated medical, psychological, or physical conditions, or patients with a history of physical or psychological trauma due to restraint, and patients with non-emergent treatment needs in order to accomplish full mouth or multiple quadrant dental rehabilitation. These are the reasons to not use protective stabilization. Reasons that make the use of protective stabilization contraindicated. Documentation. In addition to the record requirements in Rule 108.8 of this title, the State Board Rules and Regulations, titled Records of the Dentist, the patient records shall include, with respect to protective stabilization or pediatric and special needs case management, the records shall include the indication for stabilization, the type of stabilization, informed consent for protective stabilization, the reason for parental exclusion during protective stabilization when applicable, the duration of the application of the stabilization, the behavior evaluation and rating during stabilization, any adverse outcomes such as bruising or skin markings, and management implications and plans for future appointments. And I would add, just as a matter of common sense, that you would, for the behavior evaluation rating during stabilization, that you definitely want to give some sort of description of how the patient managed or handled or dealt with or accepted the protective stabilization. And when it says rating, you can create a scale of 1 to 10, but state that if it's a 5, an 8, that it's relative to a scale of 1 to 10, indicating that 10 is the best, or vice versa. Deferred treatment. Treatment deferral or discontinuance shall be considered in cases when treatment is in progress and the patient's behavior becomes hysterical or uncontrollable. In such cases, the dentist shall halt the procedure, discuss the situation with the parent or guardian, and either select another approach for treatment or defer treatment based upon the dental needs of the patient. Upon the decision to defer treatment, the dentist shall immediately complete the necessary steps to bring the procedure to a safe conclusion before ending the appointment. A recall schedule shall be recommended after evaluation of the patient, risk, oral health needs, and behavior abilities. In other words, part of pediatric and special needs case management does not always need to include protective stabilization, but rather there is an expectation and a duty to defer treatment and discontinue treatment, and where there are cases when treatment is in progress and the patient's behavior becomes too uncontrollable, unmanageable, or hysterical. This concludes our review of Rule 108.13, Practice of Dentistry on Certain Children, and Rule 108.14, Pediatric and Special Need Case Management, Protective Stabilization. If you have any questions about these rules, you should direct them specifically to the Texas State Board of Dental Examiners. The address is on the screen. I do recommend that you send mail to the board with your inquiry as opposed to making a phone call. You're much more likely to get a response via the mail on any questions that you might direct to the Texas State Board of Dental Examiners. If you have any questions about this presentation or any presentation in the risk management series covering the rules of professional responsibility in Chapter 108 of the Board Rules, please send an email to utsdcontinuinged@uth.tmc.edu. We will do our best to respond to your questions or need for clarification. The references for this course is the Texas State Board of Dental Examiners Rules and Regulations found at this URL. This completes Dental Practice Risk Management through Regulatory Compliance, Part 11. Texas State Board of Dental Examiner Rules 108.13, Practice of Dentistry on Certain Children, and 108.14, Pediatric and Special Needs Case Management, Protective Stabilization. It is now time for you to take a short exam in order to complete the requirements for streaming video courses. Due to the nature of our subject content, a passing score of 90% is necessary in order for you to pass this course. Upon a successful completion of this exam, you will be visually informed that you have met the requirements to proceed. I recommend that you locate the rule online or these rules, print them off, and have them available to you in printed format as you work through the exam questions. If you fail to answer enough questions correctly, you will be instructed to take the exam again, and a new set of questions will be provided. You will have 3 chances to fulfill the requirements. If you are not successful, you will be instructed to view this section again. Again, I recommend print off these rules and have them available hard copy as you work through the exam questions. Good luck on the exam. If you are ready now to take Dental Practice Risk Management through Regulatory Compliance Part 12, State Board of Dental Examiners Rule 108.15, Emergency Preparedness, then upon completion of this exam you will be provided a link to continue. If you wish to proceed at a later date, you will need to log in and no further payment is necessary since this is a continuum.